Hi, my name is Mark Kennedy. I'm Director of Winchester Sports and Spine. We're a multidisciplinary chiropractic and physio clinic here in the heart of Winchester. I want to talk to you today about why you get pain. Back pain, neck pain, the little niggles that just go on and on and on. Many of our patients will have a wide range of different conditions when they present to us for the first time. But often there's a common theme running through what they tell us. They don't know why they're in pain. They don't understand why they're in the level of pain given the fact that they haven't really done anything to deserve it. They can't explain to us what the mechanism of their injury is. These are the types of patients who experience little niggles over the course of their life which go away relatively quickly, but perhaps in more recent times those aches and pains have become more frequent or more severe, or they've just lasted longer, so that eventually they're spending more time in pain than they are out of it. They're the patients who don't do anything different in their life. They may go to the gym, work out in a normal way, but they have pain afterwards. They may be bending to take something out of the oven or put something in the dishwasher and their back gives out and suddenly they're in a lot of pain. They bend down and stroke the cat, just everyday normal things, and bingo, they suddenly go from being perfectly comfortable to suddenly being in a huge amount of pain. And we conclude that these patients are presenting with the end point of a long-term repetitive strain injury. They are at the end of their body's ability to compensate and to cope with those physical stresses and strains in their lifestyle. And it's what we call physiological adaptive range, that finite level of compensation is the range through which the body can adapt. This chart here shows that in a graphic form. So, in theory, when we're born, we have the perfect health. We have our maximum tolerance to the stresses and strains that are going to come our way in life. This chart shows those as 5 different categories. I'm going to break that down even further into 3 broad categories of stress. Physical things, the obvious knocks, bumps, injuries, fractures, dislocations, surgeries, those sorts of traumatic events that occur to our body that changes and alters its structure. But broadly speaking, these are things that our body will heal from. We can get better, we can get over it, and we can move on. Mental emotional stress. We carry that stress in our body. Many people who are very anxious and stressed will adopt slightly defensive, crouched, flexed patterns of movement. People who are happier and more relaxed and more confident will be more open and neutral in their posture. Emotional stress and strain over time will certainly start to manifest problems in your posture and in the degree of muscular tension in your body. The third category is dietary or chemical stresses and strains. So not just dietary, even things like the chemicals that are used as fire retardants in furniture and clothing, cleaning fluids and materials, even cosmetics. These things are at work on us all the time, and some of them are not tolerated particularly well by our body. From a dietary perspective, of course, we all know that sometimes we eat things that we shouldn't, too many of the things that we shouldn't, and we don't have enough of the things that we should. Our internal organs that are first in line for dealing with those chemicals often are hooked up via our nervous system to our spine, to our skeleton ultimately, and we can end up with physical compensations for chronic chemical stresses and strains. Long term is what I mean by the word chronic, stresses and strains on our body over time. So all of these things are common everyday stresses and strains that our body must compensate for and adapt to. And all the while we're doing that in our early life, usually we can stay pain-free, we can stay asymptomatic. but our tolerance to experiencing these aches and these stresses and strains diminishes over time. And so this is the sort of time in our lives when we can experience aches and pains, but we get over them relatively quickly and we just move on. We always say that, you know, kids get aches and pains, but they recover really fast, don't they? They bounce and they get up and they just off they go. Well, that's because they're experiencing those stresses and strains somewhere up here on their range, their adaptive range. As we get older and we experience more of these things, our adaptive range, or we move closer to the end point of our adaptive range. We're still asymptomatic, but maybe those aches and pains last a bit longer. They don't heal quite as fast. Until we get to the point where we have had maximum adaptation from our body, we have got minimum tolerance to more of these stresses and strains, and then we do something just normal and everyday. We bend down and we stroke the dog, and our back suddenly gives, and we're locked in a spasm that just doesn't want to go away. And usually this is where we see the patient. This is where patients will come to us in this very acute, sudden, painful state. Now, I'm happy to say that if we ask the right questions and examine the patient thoroughly, we can understand what tissues are injured. We can come up with a treatment solution that will involve usually a certain amount of physical work, but also sometimes looking at lifestyle, looking at work environment or leisure activities, looking at diet, talking about areas of life that may be causing, you know, undue amounts of mental and emotional stress and strain. And as we go through that treatment process, we can move the patient from being symptomatic to being asymptomatic, and so we can assume that we're helping to peel away those layers of compensation, those adaptations that have occurred over time, and move the patients back into a more comfortable adaptive range. That isn't to say that we can shift all of those stresses and strains of life. Of course we can't. They'll still be there to a degree, but they'll be experiencing those stresses and strains at a point in their adaptive range which allows them to stay asymptomatic. Of course, anybody left with those stresses and strains again over time can build back up to that maximum adaptation, minimum tolerance, and jump back into having symptoms again. This is where things like maintenance care, the occasional checkup, can come in handy, making sure that you keep a healthy, sensible diet going, making sure that you're doing the right forms of exercise. So, with the right sort of care, patients will improve. If you would like to talk to us about your aches and pains, then our web address will give you all of our contact details. That's winchesterchiropractor.com. If you're local and you'd like to come in and talk to myself or one of my chiropractic colleagues about your aches and pains, then we would be delighted to see you. Just give us a call on 01962 843 242 and speak to one of our friendly reception staff, Janet, Judith or Fiona, and they will be delighted to book you in for a consultation. We'll sit down, discuss your problem, we will talk about your past medical history, we will examine you thoroughly, x-ray you if necessary, and then we can sit down and discuss what's wrong, why it's wrong, and what we might be able to do for you. So I hope that's made it a little bit clearer why some of the aches and pains that you may be experiencing just won't seem to go away. It's to do with this adaptive range and the fact that you may well be bumping along the bottom of your adaptive range, and something needs to alter, something needs to change within your body to make you compensate more successfully for the aches and pains or for the stresses and strains of your lifestyle, and to make you more comfortable. Look on the web, winchesterchiropractor.com, for our contact details, or just give us a call, 01962 843 242. We'd love to see you.